Hello again, this is Mesar for the Medical Sales Channel. One of the questions I am asked frequently from new medical sales representatives is about appropriate medical sales etiquette. Now, I'm really surprised that it's the new healthcare reps who are asking this question because I see a lot of seasoned healthcare reps who've been out there selling for a long time, and they should really be asking this question because their medical sales etiquette is not all that it could be or should be. So let's talk about a few things. I'm doing this from the top of my head, so this isn't some type of definitive list. These are some things I want you to think about when it comes to medical sales etiquette. The first thing is you. A big part of etiquette is how you dress. Do you look professional? Now, there's a lot of variability in what constitutes professional dress in healthcare sales. I'm going to let you use your own judgment, but let me ask you this. Is it appropriate for you to wear a shirt and a tie, or even a jacket and a tie when you're calling on your healthcare customers? You see, you can never look like too much of a professional. You can never be overdressed. Unless you're selling, let's say, in a place that's very casual. For example, I used to sell in the Florida Keys, walked in there in a tie one time and they said, "Excuse me, there's only two people who wear ties in the Florida Keys, tax collectors and other government agents." So I stopped wearing a tie because it made them nervous. But always try to look as professional as you can. In that situation, what I did was I went to wearing a polo shirt that had my company's logo on it. So professional dress. Make sure you're shaved, your hair is styled, and you don't smell bad. It seems odd in this day and age to have to say something like that, but it's a reality. I can only tell you what I've experienced out there in the field. The next thing is when you go into a doctor's office, you may have to spend some time in the waiting room. So here's a couple of rules for the waiting room. First of all, if the waiting room is crowded, you stand. I can't tell you how many times I've gone into a doctor's waiting room and there were a bunch of medical sales reps. Maybe they were attorneys, there were people in suits and ties and they had briefcases. But I know some of them were medical sales reps because they had samples and sample bags and brochures. Attorneys generally don't carry brochures unless, well, we won't get into that. But the medical sales rep should not be the person who's sitting when there's patients standing. So if patients come in and they need a seat, you get up. It's just common courtesy. Let's talk about now when you get back there to see the doctor. When you get together with the doctor's name always begins with doctor. Now, I know there's situations where you're on a first name basis with the doctor, but don't get too familiar too soon. And if you do get familiar, only get familiar once you're invited to do so. If the doctor says, "Hey, call me Bob," then call him Bob. Of course, make sure his name is Bob before you call him Bob, but a good rule of thumb is that when other people are around, if there's patients around, if there's staff around, revert back to saying doctor, because that's who he is or she is to the staff and to the patients. A little common sense goes a long way. Also, when you're in the office or in the healthcare environment, whether it's a hospital or a clinic, a good point of etiquette is to keep your voice down. Patient care is going on here. Don't discuss business. Don't speak in a loud voice. And by all means, don't talk about patients, especially using patients' names or discussing a situation with a patient that you just became familiar with. It violates HIPAA. But we're talking about etiquette here. From an etiquette perspective, it's just poor form. Doctors aren't going to trust you, and his staff won't trust you when they hear you talking about their patients out loud in a public environment. This includes elevators. I can't tell you how many times I've been on an elevator in a hospital. There were sales reps there and they were talking about a case that they just observed, or they were talking about a doctor, or they were talking about a patient. Just don't do it. Another point of etiquette is to always be on time. I know this is common sense, but so many people aren't on time. And here's the thing. Sometimes you get held up in traffic or you're delayed for whatever reason. If you're not going to be on time, pick up the telephone and call or text. Say, "I'm running 10 minutes late due to traffic. Will this affect our appointment? Do I need to reschedule?" Be honest and upfront. Now, of course, no one likes to put themselves in the situation of having to reschedule with a healthcare provider. But you can avoid this by making every effort to be early. But when those unforeseen moments occur, let the customer know that you're running late. It's common courtesy. The last thing I'll talk about is remember who owns the space that you're in. Whether you're in a doctor's office or a hospital or a clinic, you are a guest in somebody else's house. It's never inappropriate to ask if you can have a seat before you take that seat. Or if you're going to visit a different part of the house, in other words, a different department or a different part of the treatment area, it's never inappropriate to ask if it would be okay. Don't forget, you're a guest. You just can't walk in there like you own the place, even if you've been calling on that customer for 30 years. Remember who owns that space and treat it accordingly. I'm sure I'll come up with more, and when I do, I'll produce another video. But here's an idea. If you have any ideas about some elements that I could add to this list of professional medical sales etiquette, please email them to me, mace@medicalsalestraining.com, and I will include them in the next video. Plus, if you're watching this video on YouTube, I would greatly appreciate it if you would click on the like button. It looks something like this, a thumb up in the air. Click on that to let everybody know that you like it. Because, ladies and gentlemen, when I see these likes, that's what keeps me making these free medical sales videos that many of you tell me are very helpful to you in your career. So I appreciate it. Go out there and make a difference. Remember, be competent, sell more, and make a difference. That's what medical sales is all about. For the Medical Sales Channel, this is Mace Haroff. I'll talk to you soon. Bye for now.